All right, there has been growing concerns about body image with the rise of GLP-1 weight loss medications and the return of extreme skinny culture. Health officials have also noted an alarming rise in muscle dysmorphia and body dissatisfaction among young boys and men.
Yeah, it's a real thing. Dr. Itai Danovitch is chair of the Department of Psychiatry and Behavioral Neurosciences at Cedars-Sinai. He's here to talk about the very important issue, and I do think it's an issue that I've even seen show up in my household that I don't think a lot of parents are talking about or realize how big a deal this is, doctor.
Yeah. Well, so there's a broad category of things that are going on. There's eating disorders, and traditional eating disorders are things like anorexia and binge eating disorder and bulimia. These are conditions characterized by basically like inappropriate, inflexible patterns of eating with dysfunction and distress, and often with distortions in body image. And there are a lot of things that contribute to the presence of eating disorders, including our culture and what images of bodies we're presented with.
Right. And that's why we wanted to have you on, because this feels like a conversation being shaped by pop culture right now, with a rise in a lot of celebrities becoming extremely thin with the rise of GLP-1 drugs. And you often wonder if that is reflected in what you're seeing in the doctor's office.
Yeah. Well, I should say it's very hard to make a judgment about whether somebody's suffering from any kind of condition based on what you see on TV.
Right, which is what makes it even harder.
That's right. You can be underweight, you could be overweight, doesn't mean you have an eating disorder.
Right.
But for sure, we are in an environment where we're constantly presented with images that are unrealistic of what's attainable with one's body. We are constantly confronted with platforms like social media that cause us to appraise and assess our own appearance and compare it to unrealistic representations.
Right.
And that's contributing to more challenges and distress, trying to figure out the balance of what is healthy and what is appropriate, what is normal for people.
Right.
And really, it's so nuanced, right? I'm sure you have a wide spectrum of patients who come into your office, and some may look underweight and some may look overweight, but there's not necessarily an eating disorder going on. But everyone seems to want to comment on everybody's body, whether we put it on social media or even in person. I know there's some mothers who are still hypercritical of both their daughters and their sons of what they look like. So how do you have these conversations, and should we be commenting on people's bodies?
Well, I think that the era that we're now in, where we're often interacting with other people, but not personally, not one-to-one like this, that allows us to make judgments about people that are reductionistic and overly simplistic and not holistic. That's a problem.
Yeah.
Because you can make a snap judgment of an image of somebody and post that and not really feel the humanity of what's going on. So we all need to take a breath and slow down and hold back our judgments, because these platforms and these media create and facilitate behaviors that don't make us happier, don't make us healthier,
and they
not a good community.
Actually productive. But how do you have a conversation if you look at someone, it's someone you know, and it's extreme weight loss or extreme weight gain, and you're genuinely concerned about them? What is the proper way to start a conversation if I am concerned about your health?
Yeah, well, first, it's always difficult when you're concerned about somebody's health.
Right.
For any reason, whether it's psychiatric, whether it's medical. But when you care about them and are concerned about them, the best thing to do is to directly express their concern. I'm worried about you. I've noticed there's been a change in your behavior. And then to ask them, are you concerned? Do you have any worries about that? The biggest worry we have, and the challenge that we get into when we're trying to support somebody we care about, is that we're going to drive them to be reflexively defensive, or feel that we're intruding on them.
Well, and I feel like it's somewhat the same when it comes to substance use issues. Like people will go to their partner or somebody they love and say, I want you to stop drinking. Well, that person, unless they're willing to take on what's happening or even see that they have a problem, I feel like it's somewhat the same. Is it that the person actually just has to get there themselves, whether it's weight or a substance abuse issue?
There's no one size fits all. And for some people, a single concerned comment from their partner or from their friend is enough to get them to go talk to their primary medical doctor about it. For other people, you can persist and nag and confront them, and it's very hard to alter their behavior. So there's not a single answer, but I think that trying to be direct, coming from a place of one's love or care or concern for somebody, and then listening, asking questions as opposed to presenting judgments tends to be a more effective way. The last thing I would say is that it's a marathon. It's not a sprint. You often don't get a response the first time with any at time you're trying to influence somebody. And so, you know, taking your time but persisting with your concerns over time is probably the best way to get somebody to address something, and encouraging them to see or talk to their doctor if it's a health issue. That way they can get an independent opinion.
I do, before we have to let you go, but I do want to just ask you, from what you've seen personally, we've talked for years, decades, about women and this issue, but it seems that men and boys are starting to maybe have an increase in this. Is that what you're seeing in your practice?
Yeah, this is, I mean, so within eating disorders in men has always been under-recognized but present. It's about a third of eating disorders also occur in men. Now, on top of that, there's been an increase, a faster rate of increase in eating disorders among men than among women, largely because it's thought of these cultural phenomena that we've been talking about, like look-smaxing and all of these presentations of body image and muscularity and appearance that are really tapping into normative processes that we have to pay attention to how we look and to care about what people think and to try to optimize. Nothing wrong with that. The problem is when it becomes rigid, disproportionate, when it displaces other healthy things in our life and gets in the way of what Freud said is the ultimate goal of health, which is to be able to work, to play, and to have healthy, loving relationships. So
it's that simple.
Yeah, well, Dr. Danovitch, it's a very complicated issue. We do appreciate your insight on how to
you.
start these conversations. Thank you.
All right, let's get